Hello and welcome. This is Intimacy After, a podcast for mature women facing intimacy issues from various causes. Please know you are not alone. It is time to stop suffering in silence. On this podcast, we give hope that through practice of simple steps and proven tips, you can improve intimacy and resurrect your love life. Break free, learn to laugh again, to play again, to be happy, to love, and know that you are loved. I am your host, Queen. Come on inside. Hello and welcome inside, sister friends, to another episode of Intimacy After. I am so excited to be talking about today's topic, so I hope you are ready. It used to be that mental health was a taboo. Thankfully, though not totally unstigmatized, it is remarkably better. Wouldn't you agree? I have witnessed a change since I started my journey in medicine over 20 plus years ago, especially for those in the Black and Brown communities. You are seeking assistance more and more. Bravo, my sister friend. Mental health is vast. It is as wide as it is deep. I have made mention in past podcasts, but after receiving specific questions about sex and depression, thought I would gingerly take a deeper look. I do have colleagues who are awesome counselors on depression and those who are doing great in the sex field, but combined, no. Most, not all, most psychiatrists, psychologists, counselors, etc., will treat your depression, but get quite uncomfortable when have to discuss sex. Why? Well, talking about sex is a Pandora box. There are so many different practices and preferences that venturing there put one at risk for judging and being judged. Then the sex therapists have their hands full with lots of things to uncover. Dealing with mental health and its huge scope, not something they're truly interested in. So, my sister friend, here we are. Let's see what I can do to bring the two together in a short podcast. You ask me, can I use sex as a treatment for depression? It does release all those feel-good whatnots. Can I just have sex and feel good all the time? I'm not big on medicine and stuff. You did not provide permission to use your first name in the voice message, so I'll just say the first letter, M. Well, M, that is a very loaded question. A very good question. That seems to make sense in a literal sort of way, right? But let's unpack and look at it from a practical and a mild scientific sort of way. I want to interject here that as I'm unpacking M's question, that I am a big advocate and proponent for saying there's no such thing as a silly question or a stupid question, right? I think it's on the part of the person who's been asked the question to take the time to pause and dissect what's being asked. True enough, sometimes the person asking the question is not quite sure how to phrase the question so that it's understood. And so I like to take the time to break down questions as they are asked. I know sometimes I say the questions asked or I repeat the questions that are asked by some of my listeners, and I get feedback that, oh, well, that's a silly question. Well, not really. I want this platform to be a place where your questions can be honored, and I will do my best to break things down and dig deeper. And you may be asking questions that you're not even really aware or quite sure of what to ask. Well, that's what I'm here for. Let's break it down and look at what M is asking, right? So the question is, can I use sex as a treatment for depression? It does release all those feel-good whatnots. Can I just have sex and feel good all the time? I'm not big on medicine and stuff. So I wanted to do a little research on this to see if anyone else actually looked into this before. Yes, research. I am a doctor. Stop acting surprised. I want to make sure that I am giving you good and adequate answers to your questions, right? Your question is important, Em, and others have the same question or thoughts too, so I wanted to give it my full attention. Thank you, ma'am. I didn't know there are journals called the Journal of Sexual Medicine and Archives of Sexual Behavior. Like, what? It does make sense, I guess. But I was too deep in cancer treatment and oncology stuff to look up and breathe or talk about such things back then. Thanking Jesus, I'm able to step away for a while from that journey that began back in 1999 pursuing medicine. But medicine is in my blood. The Journal of Affective Disorder and the Depression and Anxiety Journal, that's the norm for me. Here I am learning something new. You see? Thanks, Em. My little research in the area of sex and depression had limitations and ethical consideration, and often these research, admittedly, state that they face challenges, and some of these challenges include difficulty in recruiting participants, potential reporting biases, ethical consideration in studying vulnerable populations, and the complexities in isolating variables due to the multifaceted nature of both depression and mental health. And I want to add to that the many shades of sex. Another reason why your question is so deep, Em, is because we have to peel back and look at several questions in and of itself. Your question is quite layered. So we want to look at what is depression and how do you know you are depressed? Should I assume that you have already been officially diagnosed with depression, or is this self-diagnosis? If you're diagnosed with depression, Em, then another question is, what is the impact of depression on your sexual health? On the flip side, what is the effect of sexual activity on depression symptoms? Is it as you think, or are there other unpleasant side effects to think about? Sex having side effects? That's new, right? Then there's the influence of antidepressants on sexual health. You are not alone. Not many like to take medications, but sometimes the body needs a little help to correct certain changes in the brain and other imbalances. There are also gender differences in the relationship between depression and sex. The way that male and female respond to both are different, and the way you respond is also different from others, different from me. Does sexual satisfaction play a role in mental health? Em, there you have it. Lots of hidden questions within yours. Where to start? Let's look at your question again to stay on track here. Can I use sex as a treatment for depression? Let's start with the first part. Sex as a potential treatment for depression. Believe it or not, sister friends, you all are scientists and researchers and don't even know it. There are some studies that have examined whether sexual activities can have a mood-enhancing effect and potentially alleviate depressive symptoms. Imagine that, huh? This research area often looks at the release of neurotransmitters and hormones during sex, the feel-good stuff and whatnot that M refers to. To show the complexities of sex and depression, these studies look at different aspects of mental health. There are different types of depressions as well. Did you know that? Not that we're going to forget about the sexual dysfunction part, but there's also a serious potential issue when it comes to certain types of depression that can lead to increased risk of suicide, taking one's own life, and suicide discussion came front and center while I was still serving in the Army. Many young soldiers would return from conflict depressed and wouldn't know what to do about it. Some would not seek help, trying to be tough, and this was evident in the rise of suicide. Kudos to the military for stepping up and creating sensitivity classes, teaching leadership and staff what to look for, what changes would hint to someone who is experiencing depression and may even be at risk for suicide, and so much more. Asking you about depression is now, in most cases, a common part of the intake form whenever you visit your clinics. Sister Fran, do you know some common signs of depression? Here comes my disclaimer. Just in case you're listening for the first time and happen on this podcast, I am Queen, your family-friendly cancer doc. Via the podcast, I am not a part of your medical team. I am not a counselor or psychiatrist. I have learned a lot over the years taking care of my patients diagnosed with cancer. Many of the topics here are part of my common survivorship model for these patients. However, please ask your doctor about anything discussed on this podcast. If you review some of the questions that will be discussed later and find that you are at risk for depression or suicide, seek help immediately. Don't delay. Okay, so there are many forms on the website that you can use to self-evaluate if you are depressed. A depressed mood can also be temporary based on life changes. You know the mantra, speak with your primary care provider. Okay, here goes. So while you're swiping left or swiping up or checking out all those social media, take a step back to do some self-evaluation and check out things that you could benefit from. Just go to the National Institute of Mental Health and look up whatever questions you may have, be it about depression, anxiety, or anything along those sorts. You can also go to CDC and type in mental health conditions, specifically depression and anxiety, and you would also find information there. They will give good insights on the different types of depression, common treatment, and much more than this podcast can provide. Depression can affect people differently, and there are some common signs you can look for. If you are writing this down, I will give the big umbrella term with a few examples to follow. Here we go. Mood. Feeling sad, anxious, or empty most days for more than 2 weeks? That is something to consider. However, I can interject by saying, I feel sad some days when I think about my mom. I miss her very much. I do have sad feelings and empty feelings some days, especially on Sundays when we typically catch up about the week. So there is a difference if your sadness is associated with the death of a loved one. Again, this is just for you to take note, right? Interest. Losing interest in activities that used to be fun. Are you too busy to have fun or depressed and don't feel like doing anything? If you used to go out for walks or go to the movies or go shopping, what are you doing instead? Sleep. Are you having trouble sleeping? Waking up too early or sleeping too much? Difficulty falling asleep or difficulty staying asleep? Make a note. Appetite. Are you eating more or less than usual or having no appetite at all? Energy. Are you feeling tired even after sleeping well or lacking energy? Thoughts. Are you feeling hopeless, pessimistic, or guilty, worthless, or helpless? These are the things that can spiral very quickly. Then there are behaviors, feeling irritable, easily frustrated, or just simply restless. Cognitive, having trouble concentrating, remembering details, or making decisions. I have or know of people who just have a difficult time making decisions. For me, who is military, make a decision, even if it's the wrong one, you just think about it, evaluate, and decide. For someone who go back and forth between three stuff, it'll drive me bonkers. But that is a personality trait for some folks. If making decisions is difficult for you and it's an ongoing thing, then that may not be pointing to a cognitive issue leading to depression. It could be just your personality trait. If this is new, then you want to look deeper and here it comes. Talk to your primary care about this. Physical. If you're experiencing aches and pains and headaches or stomach problems that don't improve with treatment, then you want to look a little bit deeper into that. I know for my listening audience, most of you are over 40 and you're thinking, aches and pains, if that is what makes me depressed, and I'm depressed all the time because I'm always aching and in pain, especially when it rains and the bones and da and da. No, that is not what I'm talking about. So, just to do a quick rundown on the areas I reviewed, if you think that you may be going through some depressive symptoms and you're not sure, jot these down, put a call into your primary care team and have a discussion. Mood, any sort of changes, interest, losing interest in your activity, sleep, appetite, energy, your thoughts, behavior, cognitive, physical. Again, remember we say cognitive, we're talking about your brain and your thoughts and thinking and concentrating, right? If you feel depressed, you should make an appointment to see your doctor or a mental health professional as soon as possible. You can also talk to a friend or a loved one, a faith leader, or someone else you trust if you're reluctant to seek treatment. But remember, that's a big burden to put on someone, right? If they're a friend or a loved one and you're depressed and you do the dumping and tell them all of that stuff, they can assist to a certain level. Let that decision be made with communication you have with your doctor. That's why it's so important for you to get to know your care team, so you know who you work with, so that you can reach out to someone you're comfortable. It's not always a physician. Sometimes it's a nurse practitioner, a physician assistant, or other high-level caregivers that's within your team. You have to be prepared for your appointment. When you see your doctor, you can bring a list of things to note, including your mental and physical health concern. Let me back up a bit here. Going to your doctor without a list of some sort or something written down to discuss, it's not recommended. Then the conversation will be one way. That's not how you want it to be. So be prepared for your appointment. When you see your doctor, you can bring a list of things to note or discuss. You can talk about your mental and physical health concerns. Write those down. Past medical and psychological illnesses, family history of mental illness is so very important. You need to have that info. Medications you're taking, including side effects you're experiencing, natural dietary supplements you're taking as well. So if you're drinking certain teas and taking certain supplements, you need to make sure you write those down or bring the bottle with you. Your nurses, they will love you for that. Your lifestyle habits, such as exercise, your nutrition, smoking, alcohol consumption, and drug use. Look, they're not there to judge you, but they can't make the appropriate recommendations if you are not honest with them. So write these things down, and even if you're feeling judged, guess what? Hey, it's okay. You're going to be one of 20 or so that they're seeing that day, so you just go and get what you need, talk to them, and step out smartly. Getting back to some of the journals I reviewed, one good example I came across was from Delosa et al. 2009 in the Journal of Sexual Medicine, who conducted a research to explore the frequency of sexual dysfunctions in patients with bipolar disorder and unipolar depression. Remember, I told you there are different types of depression, and that is beyond the scope of this podcast. But just so that you know, in this research, it found that lifetime impairment in the sexual response cycle was significantly more common in patients with mood disorders compared to control subjects. Sexual dysfunctions were also significantly associated with lifetime suicide attempts in patients with bipolar disorder and thoughts of death in patients with unipolar depression. This, again, is stuff you need to be aware of. There is nothing weird about you, or don't feel condemned. If you were back there and saying, so that's what it is, the next step should be, I need to make an appointment. Another key area of research is depression and sexual dysfunction. Many studies explore the link between depression and various forms of sexual dysfunction. For example, research has shown that individuals with depression often experience decreased libido, desire to have sex, difficulty achieving orgasm. Now, let me pause here. If you never or seldom had orgasms, then it would be tough to know if depression is a culprit, right? Then there's also erectile dysfunction in men. That's the upcoming featured podcast as well. So could it be you're asking this question because you're not feeling your usual sexual self? Whatever usual may look like for you. If you've been diagnosed with depression and noted no change, because there's nothing to change, then we should seriously talk. Sex, orgasm, that's like the dessert. But if there's nothing broken, that is, dessert is not your thing, then there's nothing to change or fix in the sex department. Though I bet to defer on that. Let's treat the depression though. You may think you're having great sex, but if you're depressed and you treat your depression, is there a possibility that you can have even better sex? Imagine that. This is a young podcast, so I'm aware that about half of you are Christians. As you may have surmised, this is not about converting anyone to follow Christ, though I don't mind planting a seed here or there, but I am using His gifts to impart knowledge and understanding to everyone about certain things that will remove the wall that's preventing you from looking in the direction of Christ. It is my hope that you all realize that Christ is not wrapped up in religiosity. I may not be doing things 100%, but God does equip the called. So pardon me while I get dressed. As a Christ follower, I grew up learning that God will take care of everything. And there may be some of you thinking that someone is less spiritual if they're diagnosed with depression. Because, after all, the joy of the Lord is your strength. The joy of the Lord is indeed our strength, but I have learned that the Bible is an instruction book on how to live, how to serve Jesus through serving people, how to bring God's kingdom to earth. The Bible is not a religious book per se. If you search the pages of the Bible, you will find many saints who were depressed and lots to be said about intimacy and sex too. Good stuff. I can hear you. I can hear you. What Bible are you reading? Who was depressed? Who talk about intimacy in the Bible? Okay, my sister friends, I love you. Here we go. Who was depressed or faced mental health issues in the Bible? Read up about King David. Yes, indeed. Elijah fell into despair and even asked God to take his life. Naomi experienced grief after losing her husband and sons. Oh, what about Job and Hannah, whose life was marked with anguish of unfulfilled longing, needing and wanting to have a child? That should suffice. But there are more that my Bible scholars in the podcast land can make known. I'm not a woman of the cloth. No leadership position in the church. I am not an elder or a deacon or anything of the sort. I'm simply trying to respond to God's love, mercy, and grace by removing some lies. My scholarly background was not just meant for me. It's for you too, sister friends. And as you can see, I like digging into stuff and researching and looking up things, not only to apply in the cancer world, but to answer questions that you, my listeners, have posed to me. I love learning. Life is all about learning, and that does not exclude learning about Christ and what he has to say about some of these topics. Want to know what the Bible has to say about intimacy and sex? Well, start by learning how to speak to your spouse. Awaken his loins. Check out the book of Songs. It is filled with raunchy love letters. Can I say raunchy? It's in the Bible, so we'll just say it's some surprisingly good stuff. The Songs of Solomon is tucked away in the Old Testament just before Isaiah. Wait, let me look at the flow for you. It's Psalms, then Proverbs, Ecclesiastes, Songs of Solomon, and then Isaiah. See, you don't need to have all the books of the Bible memorized to serve God. But I tell you what, read the book Songs of Solomon. You may want to try in the English Standard Version if the Elizabethan King James Version doesn't jive for you, but read it in one of the contexts that you can relate to, NIV, ESV, Message, whatever works for you. But don't skip over Songs of Solomon. Hear them talk about loins and bosoms and all that good stuff. Sister friend, it is in the Bible. God loves us and wants us to know that he thought about all these things that he knew we would think about. The other part of your question, M, about disliking medicine, it's all about the details and type. I too, though a physician, grew up in a time in the Caribbean when my mom would boil cerasee tea for different ailments or rub down my body with bay rum to quieten the fever. Very few and far between do we ever use actual purchased medicine. And visits to the doctor was thought, well, it was deemed only necessary when roots, teas, mixtures, and different stuff couldn't work. So I too, though a doctor, do not like the idea of taking a medicine that causes side effects, then taking another to fix the side effects from that. And if that causes side effects, then another medicine. You get the drift. It's a spiral that requires control. That answer requires some realism though, right? It begins with, how bad is the first side effects? Is it tolerable? That's a discussion for you and your medical team to have. I am a big advocate for getting to know and talking to your health manager team about your medical concerns. So if you have a diagnosis that requires medicine, take the medicine. You want to drink your tea and have some roots? Let them know that you're going to drink the tea and have these roots too. But take the medicine they're giving you. If you're having some side effects, how bad is the side effect? You know, I did a blog many moons ago. I'm going to have to do a podcast on it. That everything natural isn't natural because it doesn't cause side effects. You can have side effects from things that are deemed natural too. And I will get into that another time. But yes, you can. This goes beyond medication for depression, but any diagnosis. treatment or medication. With that being said, there are a significant body of research focusing on the sexual side effects of antidepressant medication. That is medication that you take for depression, particularly one called selective serotonin reuptake inhibitors, or SSRIs. You'll hear them mentioning it in commercials. Listen for it. SSRIs. These studies investigate the prevalence, nature, and management of sexual dysfunction associated with antidepressants use. So yes, the side effects can lead to sexual dysfunction if there was one to talk about in the beginning, though. Sister friend, just being honest and real with you. If you're not having sex, you're not enjoying sex, and you're not having an orgasm, and then you are diagnosed with depression and you start taking this medication, you cannot say the medication is causing you to have sexual dysfunction. It could be that the depression was causing it, but it can't be the medicine and then you stop taking the medicine for depression because it says, oh, it causes sexual dysfunction, but you weren't functioning sexually before. Being honest, you get to decide if you're going to not tell yourself the truth. So, are you going to give up sex because you are depressed? I think not. Where there's a will, there's a way. So, can you use sex as a treatment for depression? Not really, at least not by itself, per my brief research. It does provide that momentary good feeling from the serotonin and hormones, but it is temporary. It's a surge. How long and how often would you need to have sex to use as a treatment modality? It does release all those feel-good whatnots that M mentioned in her question. So, would that really work? While you're not required to go around grinning like a Cheshire cat all day long, medication does offer a more balanced, long-term effect for treating depression. And it does matter the type of depression that you have as well, as we previously discussed. If you were diagnosed with depression and you take this medication, you may be surprised at the many things that can also change. You may come to terms to saying, oh, wow, I didn't realize this was less, or that was less, or that was being affected. It can also give a positive outcome. For the love of the Almighty, stop self-diagnosing. You could be hurting yourself. Let your primary care medical team do what they do best. Based on your answers to the depression evaluation questions, for a set period of time noted, they can make appropriate suggestions. And know that some of the suggestions may have nothing to do with medication. You may just need to do some yoga. You may need to do some de-stress. You may need to do some meditation. They don't always right away dump medicine on you. It all starts with a conversation. Look, sister friends, intimacy and sex is a part of life. Don't let depression steal that away from you. Well, sister friend, I know you have choices, so I thank you for tuning into Intimacy After podcast. You may subscribe for bi-monthly alerts or stay in the know by visiting my website at queenquanta.com. That's Queen, QUANTA.com. Until next time, remember, a life without intimacy is like your favorite meal without salt. Ladies, let's spice it up. Life is beautiful and God is awesome. This is Queen, signing out.